Every organ that can fail without warning explained in 15 minutes. The human body is a biological machine with an extraordinary flaw. Its most critical components can shut down without so much as a warning light. No error message. No grace period. Just function and then not. This video covers 8 organs that can fail silently, suddenly, and completely, often before you realize anything is wrong. Each one has a mechanism, a history, and a twist that the pamphlets never mention. Pay attention. This is your hardware. Pancreas. The pancreas is the organ most people couldn't locate on a map until it tries to kill them. It sits behind your stomach, roughly the size of your hand, and it performs 2 completely unrelated jobs simultaneously. It makes digestive enzymes and it regulates blood sugar with insulin. Neither job announces when it's going wrong. Ancient anatomists thought it was a cushion protecting the stomach's blood vessels. The word pancreas literally means all flesh in Greek, a lazy name for an organ that didn't seem to do much. It wasn't until the 19th century that scientists connected it to diabetes, and not until 1921 that insulin was isolated. For most of human history, if your pancreas stopped producing insulin, you died, slowly while losing weight, becoming intensely thirsty, and going blind. The exocrine cells produce enzymes, lipase, amylase, protease, that break down fat, carbohydrates, and protein in the small intestine. The endocrine cells produce insulin and glucagon, hormones that tell your cells to absorb glucose or release it. When both systems are working, you don't think about it at all. That's the point. Here's the part nobody tells you. When the pancreas fails acutely, acute pancreatitis, it starts digesting itself. The enzymes designed to break down food activate inside the organ before they're supposed to and begin consuming the surrounding tissue. The pain is so severe it's one of the most common causes of emergency room visits for abdominal pain. Chronic pancreatitis silently destroys enzyme-producing cells over years, often without major symptoms until over 90% of function is gone. By the time someone gets a pancreatic cancer diagnosis, the 5-year survival rate is approximately 12%. Pancreatic cancer has fewer symptoms than almost any other cancer of comparable lethality. Most cases are caught at stage 4. The pancreas fails and you find out in the wrong order. Spleen. Most people know the spleen exists. Almost nobody knows what it does. And nobody finds out it's failing until they're already in trouble. The spleen sits in your upper left abdomen, a fist-sized organ wrapped in a fibrous capsule. Ancient Greeks thought it was the seat of melancholy, that your spleen regulated your mood, not your blood. Medieval physicians blamed splenic dysfunction for everything from laziness to anger. The organ spent centuries being philosophically maligned before anyone bothered to study what it actually did. What it actually does is filter your blood. It removes old, damaged red blood cells and recycles their iron. It houses immune cells, particularly B and T lymphocytes, and functions as an emergency blood reservoir that can contract and release red blood cells during physical stress. It also detects bacterial invaders in the bloodstream and initiates immune responses. Here's the part nobody tells you. The spleen can enlarge, sometimes dramatically, in response to infection, liver disease, or blood disorders. An enlarged spleen can rupture from trauma that would otherwise be trivial. A fall, a car accident, even a hard cough in the right circumstances. Splenic rupture causes internal bleeding that can be fatal within hours. The other failure mode is subtler. People living without a spleen are permanently and significantly more susceptible to overwhelming infections from encapsulated bacteria, particularly pneumococcus, meningococcus, and Haemophilus. Sepsis in a splenic patients can escalate from feeling unwell to death within 24 hours. The spleen is the organ you miss most after it's gone. Adrenal glands. You have 2 of them, one on top of each kidney, each the size of a walnut. Together they produce hormones that regulate your stress response, blood pressure, metabolism, and immune function. When they fail, the body's internal emergency system goes offline. The adrenal glands were named for their location near the kidneys, adrenal being Latin for near the kidney. Their discovery as hormone-producing organs came gradually through the 19th century, culminating in Thomas Addison's 1855 description of adrenal insufficiency, a condition still called Addison's disease. The hormones cortisol, aldosterone, and adrenaline weren't fully characterized until the 20th century. But physicians had long observed that destroying the adrenal glands caused a specific and fatal syndrome involving weakness, weight loss, and darkening skin. The outer cortex produces cortisol, the stress hormone that raises blood sugar, suppresses immune responses and governs inflammation, along with aldosterone which controls salt and fluid balance. The inner medulla produces epinephrine and norepinephrine, the fight-or-flight chemicals. Every physical stressor, infection, surgery, blood loss, emotional crisis, triggers the adrenals to ramp up cortisol production. When they can't, the system has no escalation response. Here's the part nobody tells you. Adrenal crisis can be triggered by something as routine as a stomach flu or a dental procedure in someone with undiagnosed adrenal insufficiency. The crisis causes a catastrophic drop in blood pressure, vomiting, and can result in loss of consciousness within hours. Because the symptoms are nonspecific, fatigue, nausea, dizziness, Addison's disease is frequently misdiagnosed for years. The median time from symptom onset to diagnosis is approximately 2 years. 1 in 3 patients is first diagnosed during an adrenal crisis. The adrenal glands are the body's backup power supply. Most people don't find out they've lost it until there's a surge. Kidneys. The kidneys are extraordinary filtration organs that can lose 90% of their function before a single symptom appears. They are, by almost any measure, the organ best designed to fail silently. The kidneys appear in ancient Egyptian medical texts, in Mesopotamian divination rituals, in the Bible as the seat of emotion and moral judgment. Their actual function as blood filters wasn't understood until the 17th century, when Marcello Malpighi identified the glomeruli under a microscope. The kidneys filter roughly 200 liters of blood every day, passing it through approximately 1 million nephron units per kidney. Each nephron is a microscopic filtration device that separates waste from what the body needs to keep. They regulate fluid volume, electrolyte balance, blood pressure and blood pH. They produce erythropoietin, the hormone that triggers red blood cell production. They activate vitamin D. They excrete metabolic waste, drugs and toxins. The number of variables they manage simultaneously has no equivalent in engineering at that scale. Here's the part nobody tells you. Chronic kidney disease progresses silently because the remaining nephrons compensate heroically for those that are lost. Fatigue and swelling are the earliest symptoms, and both are easy to attribute to something else. By the time creatinine levels are meaningfully elevated in standard blood tests, kidney function may already be significantly impaired. Diabetes and hypertension are the 2 leading causes of kidney failure, meaning 2 of the most common chronic diseases in the world are slowly, silently destroying the organs responsible for keeping the body in chemical equilibrium. There are currently over 800 million people worldwide living with chronic kidney disease. Most of them don't know it yet. Thyroid. The thyroid gland sits at the base of your throat, butterfly-shaped, and functions as the body's metabolic thermostat. It controls how fast every cell in your body runs. When it fails, everything runs wrong, usually so gradually that the change is invisible until the gap between baseline and current function becomes impossible to ignore. The thyroid was identified and named in the 16th century. Thyroid comes from the Greek word for shield. In iodine-deficient regions, thyroid swelling, goiter, was endemic and historically attributed to bad air, bad water, or divine punishment. It wasn't until the 1880s that surgeons discovered removing the thyroid caused a syndrome of profound lethargy, mental slowing and metabolic collapse. The treatment for hypothyroidism has existed in various forms since 1891. The hypothalamus signals the pituitary, which releases TSH, which signals the thyroid to produce T4 and T3. These hormones bind to receptors in virtually every cell type in the body and regulate gene expression, protein synthesis, oxygen consumption, and heat production. Thyroid hormone is not optional. Here's the part nobody tells you. Hypothyroidism in its early stages is a masterclass in nonspecific symptoms: fatigue, weight gain, cold intolerance, brain fog, constipation, depression. Each of those symptoms has dozens of alternative explanations. The condition is vastly underdiagnosed and overmedicated simultaneously. Meanwhile, untreated hyperthyroidism, the overactive state, accelerates cardiac function to dangerous levels and can trigger atrial fibrillation, which is itself a major cause of stroke. Thyroid dysfunction is associated with cognitive impairment, cardiovascular disease, fertility problems, and bone loss. It does all of this quietly by adjusting every cellular process simultaneously, until one day you realize you haven't felt like yourself in years. Liver. The liver is the largest internal organ in the human body and one of the most resilient. It can regenerate. It performs over 500 distinct metabolic functions. And it fails silently until it is approximately 75% destroyed. Ancient civilizations considered the liver the seat of the soul, the center of vitality. The Babylonians used sheep livers for divination. Roman priests studied them before battle. For millennia, the liver was thought to be where blood was produced and where character was formed. When William Harvey demonstrated that blood circulated in 1628, the liver's central importance was downgraded, but it is still quietly running more parallel biochemical processes than any other organ in the body. It detoxifies the bloodstream, processing alcohol, drugs, hormones, and metabolic byproducts. It synthesizes blood clotting factors, albumin, and cholesterol. It stores glycogen and releases glucose on demand. It produces bile for fat digestion. It metabolizes and stores vitamins A, D, E, K, and B12. It regulates immune function by filtering bacteria from the portal blood supply. Every drug you take passes through it. Here's the part nobody tells you. The liver's regenerative capacity is both its greatest strength and its greatest liability. Because it can recover from so much damage, early-stage liver disease rarely produces noticeable symptoms. Fatigue and mild discomfort are easy to dismiss. By the time ascites, fluid accumulation in the abdomen, jaundice, and coagulation failure appear, liver function is severely compromised. Non-alcoholic fatty liver disease is now the most common liver condition in the world, affecting roughly 25% of the global population, most of whom have no idea. It is driven by metabolic syndrome and can progress silently to cirrhosis over decades. The liver is patient about failing right up until it isn't. Heart. The heart has been at the center of human mythology, medicine, and metaphor since recorded history began. It is also an organ that can develop a fatal blockage over decades and announce it once with a heart attack. The heart's role as a pump was not understood until William Harvey published his description of the circulatory system in 1628. Before that, the dominant view held that the heart was a furnace producing heat, not a pump moving blood. The Greeks put consciousness in the heart. The Egyptians left the heart in mummified bodies while removing every other organ for separate preservation. It was the only organ considered essential to judgment in the afterlife. The mechanism of coronary artery disease is slow and architectural. Cholesterol-laden plaques accumulate inside artery walls over years, narrowing the vessel. The process is inflammatory. Macrophages attempt to engulf the lipid deposits, foam cells form, and the arterial wall thickens and hardens. Blood flow decreases. Eventually a plaque ruptures, a clot forms around it, and the artery closes. The cardiac muscle downstream, receiving no oxygen, begins to die within minutes. This is a myocardial infarction. The preceding buildup is entirely silent. Here's the part nobody tells you. Up to 45% of heart attacks are silent, occurring without the classic chest-clutching presentation, particularly in women and in people with diabetes. A silent heart attack may be discovered years later as incidental scar tissue on an ECG. Meanwhile, sudden cardiac arrest is an electrical failure of the heart that requires intervention within minutes to survive. In approximately 50% of men and 64% of women, sudden cardiac death is the first and only symptom of coronary artery disease. The first sign of heart disease is dying from it. Brain. Every organ on this list could, in some sense, be kept alive by a machine. The brain cannot. The brain is not housed in the body. In every meaningful sense, the brain is you. And it fails in ways that are, by design, nearly impossible to detect from the inside. Aristotle thought the brain was a radiator, a cooling system for blood heated by the heart. The Egyptians discarded it during mummification. The nerves, the neurons, the synapses, none of it visible to the naked eye. It wasn't until the 19th century that Paul Broca mapped language to a specific brain region. And not until the late 20th that neuroimaging allowed the living brain to be observed in real time. What has been discovered since consistently shows that the brain is stranger, more fragile, and more vulnerable than any prior model suggested. It doesn't do things for the body. It is the body's organizing principle. It regulates every involuntary function, breathing, heartbeat, digestion, hormones, while simultaneously generating consciousness, memory, language, and the sense that any of this is happening to someone. Here's the part nobody tells you. An ischemic stroke kills approximately 1.9 million neurons per minute in the affected region. Time from onset to treatment is the single most important variable in outcome. The FAST acronym exists because the symptoms are recognizable: face drooping, arm weakness, speech difficulty. Yet over a third of stroke patients wait more than 3 hours to seek care. Transient ischemic attacks, mini-strokes, produce symptoms that disappear within 24 hours and are frequently dismissed as tiredness or stress. They are a warning. 1 in 10 people who experience a TIA will have a major stroke within 90 days. The brain sends one warning in the form of a symptom that feels like nothing much, and then the window closes. Every one of these organs is running right now. Filtering, regulating, signaling, producing. Doing their jobs without a status update, without an indicator light, without any acknowledgement that you exist to maintain them. The deal is this: they will keep going until they stop. The question is whether you'll notice in time to do anything about it. Get your checkups. Know your baselines. The machine is more complicated than it looks, and the warranty expired the day you were born.